Empowered Women in Health presents an interview with Ms. Cossetta Evans, former director of the Mount Olive Adventist Community Service. Themes in this interview include women, leadership in health, Black history, psychology, and nutrition. Cossetta has successfully led the Mount Olive Food Bank for over 11 years and has worked in mental health and rehabilitation therapeutic services for almost 10 years. We start by having her share her background with us.
In terms of my background, I'm a product of Jamaican and Canadian culture. My parents are from Jamaica. I grew up here in Canada. My parents came to Canada. We lived in Montreal first, then eventually got to Toronto. My experience growing up was very, I would say, I'm sure everyone probably have similar background. Those of us who grew up in Canada during the early 70s.
Yeah.
There was not that many blacks in Canada at the time when we were going to school, as being assistant secretary for the Adventist Community Services, the GTA Federation, which is from the conference or Ontario Conference. And then I did that up to 2 years, from 2008 to 2010, and then went back to the church in 2010 as a volunteer, and the leader at that time, he took ill and I became the leader. So I've been doing it as the head for over 11 years.
11 years. And it has a really interesting history as well.
Mm-hmm.
Wow. There would be certain benefits that you receive or have learned through your experience as a leader there. Could you just highlight for me some of those benefits over the years?
Well, over the years, some of the things I've learned is that the first thing I think I've tried to hold on to is that I can't do anything without God. And for me, that's very, very important.
Right. Yeah.
And He's always been my guide. And so I realized I was called to do this position, and I didn't, even though it has been a challenge. And when I say that, I mean, it's not easy when you're the leader of something where other people do not support the program.
Yeah.
And when I say other people, I mean, it is not a program that the church itself really put themselves behind. And so having to deal with that, meanwhile, it's like holding the community in one hand and the church in another, and they're more closed-minded. So you can see. Because of that, though, I've really learned be patient, to be more understanding. I've learned that, being a good leader, you have to yourself be a good follower, because you need to bring the people who serve under you, they need to be valued as well.
That is right.
And once you get them on board and they feel that you care about them and their insights, then you will start to achieve the things that you really need to achieve, because then you have the support and people.
That's right.
It's easy to motivate people and say, okay, we got to do this. Let's try this. But you have to listen as well to what other people bring to the table. Yeah.
It's nice that you mentioned that. I actually recently learned about followership. So aside from there being leadership, there's also a term that's not highly recognized, which is followership. So it's really interesting that you bring that up. In your opinion, what are the benefits of having women in leadership?
Well, being a woman myself in leadership for a long time, I think there's a lot. Women are strong. despite
Definitely.
all the challenges that we go through, and you know, and I'm sure it is we're very thorough,
Yeah.
um, and I think we're resilient, and I can't stress that enough. And the reason I say that in particular towards, about women is that we have families that we have to take care of at home.
Sure. Yeah.
And many times I'm juggling, okay, I've got to look after my elderly parents. I
Yeah.
have,
Yeah.
still my kids or siblings or whoever.
Yeah.
We're a very close-knit family, so there's always something. But um, doing this type of work that involves the community, I think I'm really blessed that my family, they were always supportive and behind me, and
Yeah.
that helped to sort of, I didn't have to, there was not a strain so
Yeah.
much because they were right there with me, and that helped. And I think that's what women tend to be, very resilient and very strong. When with the challenges that come, they push through it.
What would you say would have been your most significant barrier in your health career then?
I think for me, the most significant barrier would be maybe my honesty. I think my honesty, being, I
Honesty.
realize honesty.
Very interesting.
People aren't welcome into when you're too honest. I say that because sometimes it can actually offend people. So you have to be careful. You have to be careful. Just because you have the truth doesn't mean you need to speak it. It doesn't mean how you say it makes a difference, because the truth can offend people.
Yeah.
But I do believe that you should speak the truth all the time. And I find that sometimes when you do, it can get you into trouble. But at the same time, it's important to me very much that I do, because I think people should stand by their word.
Right.
You should live by your integrity. Is something that, without that, you're nothing. Like, you don't have a reputation to stand on. It's important to be honest. And I find, however, that to me is like, people will sugarcoat things or whatever, and I'm like, no, just tell people the truth, because you can work with the truth if you know what you're doing.
Right.
So that's what I find.
It's a strange concept, because you always hear in healthcare that transparency should be like one of the major priorities, in which I do agree. However, what you're saying is that we should learn to gauge how transparent we are in certain situations. Yes,
and also the delivery of it.
Yeah.
Like, if you had to, for example, like I've worked in the therapeutic industry, mental health. I had, and actually, I remember my first week working in mental health. I started the Monday, and by the Thursday, I had 3 suicidal cases back to back. I worked the afternoon shift, and I thought, oh my goodness, this was interesting, because actually this is my first week working in mental health. And so I remember asking my supervisor, well, how do I handle this? And to be honest, she put it back into my lap. And she basically told me, you can do this, just, and she was she gave me some input, and then told me, you can deal with this. And I went back and I thought, okay, Lord. So I had to, of course, pray first, because one of the clients had a plan. He had picked out where, when, and what he was going to do.
Yeah.
And he was at the verge where it was like, Cossetta, what am I going to do? And to be honest, the strangest thing is this particular person had just started that week, and when he called, he told me one of the centers that we work with had given him my name. And I thought, that is very strange, because I hadn't set anything up with them yet. So I'm thinking, okay, this has got to be God. So when he called, and he's concerned about his brother in another state, another province, sorry. And he was thinking his brother would have to come and clean up the mess. And he was so concerned about his brother. And so I had to make sure, okay, I could use that to help him. And he hadn't slept, and he had, like, for the whole time, because he was in debt. That's why he was at that place, being suicidal.
Wow.
And he was in so much debt that he didn't see his way out. And he thought, so he wasn't sleeping or anything like that. And to be honest, I had no idea what the outcome would be at the time, but I trusted that if I explained, we have an in-house psychiatrist and caseworker, and I told him, what would you really, really want right now? What would make you feel better? Put aside the fact that you can't change the debt. What would you do? And he said, sleep, because I have not slept. I just want to sleep. I said, okay, you sleep, and by tomorrow morning, I'm going to get you connected. Just go to sleep. Just get some rest. And by morning, I came in to the office, and everybody was like, Cossetta, you have a friend for life. I was like, what?
Wow.
And they started telling me about all these things, whatever. And I thought, I couldn't tell this. I had to be careful what I say to him.
Yes.
So in that situation, I learned that you can't be too honest. You have to be careful how you
approach things,
because I could have said the wrong thing that might have just said, oh, well, nobody cares. You know what I mean? So I think that's definitely something that opened my eyes, and I had to learn it in such a serious way, very difficult way.
But for that, you were a hero.
Yeah.
That's awesome. What would be some significant barriers to female leadership?
I think one is being Black women, being a Black, and I think one of the things I've experienced is mostly with other women. I find you have women that you will encounter that are just go-getters, and they're trying so hard to break through that glass ceiling that they don't care who they step on to get there. And so that's one of the things I have encountered myself, trying to deal with that. Women need to be a little more supportive to other women. I think we have the tools to get there, but that aggressiveness of trying to prove that I can be better than a man or can be like the same one, it's not necessary, because we have our own skills. We have our own skill set that we can bring to the table that will contribute to what needs to get done. So definitely, I think sometimes other women, and of course the racism part of it. I've experienced that. I remember my stepfather used to tell us every time he used to come home and talk about it, but I couldn't understand what he was talking about, because I didn't have that growing up. Like I said, I grew up in Little Italy. Like all my friends were ethnic. We were from all over the place. But once I started moving into the workforce, and I find if you are smart woman and you have integrity, it can become a real barrier, because people who are trying to climb the ladder in an easy way, they will see you as their as, what should I say, more like an adversary. So it becomes very challenging when you're trying to lead, but you have all these external agendas that's coming into play.
Right.
Yeah.
Wow. Nicely put.
Do you experience
Resistance when you are leading men? And how do you deal with it?
Well, I would say sometimes, but not a lot, not as much as I found with women. Women tend to have, women tend to be more jealous, more ambitious because they're fighting to find their foothold, whereas men tend to feel like it's owed to them, it's their right. You know what I mean? So it's a different perspective. So for women, it's like, oh, okay, she's a woman, so I can, go against her. I can try to fight my way up. I find with most men, I try to treat them the same way I would treat the women. I try not to be, to have that, how would I say? I don't see them as different adversaries. I find I'm, to me, whatever I need to do, regardless of who you are, I'm going to do it.
Yeah. So it's like you have to find that balance.
Yes, you have to find that balance, and you have to realize, yes, and it's not like I'm not aware that they're coming from different perspective. Fine. But then I tell myself, like, if I hold true to who I am and what I believe, in any situation, whatever I have to give, it's going to be the same. It might not come out affect you the same because obviously, there are other factors involved. However, what my expectation is for the outcome is to be the same. Like, if I have to tell you something or expect you to leave or expect you to do something because it's what I need you to do and it has to get done, then so be it.
Yeah.
You know what I mean?
It sounds much to me like equality and equity being brought into
definitely
how you adjust to the situations.
Yes.
How can women therefore navigate power structure, you suppose? How can we motivate women to lead?
I think that's a really good question. I think some women are not everybody wants to be a leader. Some women are quite contented to just be comfortable with whatever life they've chosen for themselves.
Yeah.
But I think almost all women are born leaders. And I say that because we don't realize the power that we have. We, especially if you're a mother and you have a husband or a spouse, whoever at home, and you got to take care of your family. Right there, running a household is a business. It puts you in a position, whether you like it or not, you're a leader. Yeah. And if you have a good companion, and you become part of whatever they're venturing out to do to provide for the home, and you're well respected for that. However, outside of the home, if you're seeking to be, any leadership role, I think support. It's important to support each other, to encourage each other as women, to say, yeah, you can do this. I notice as I've been fortunate enough that God has really, really opened doors for me. So whatever position I find myself in, I always rise to the top. I always start off and then I end up becoming either the supervisor. Like I end up rising to the top. And I didn't notice that until recently when I'm going through and I'm like, oh my goodness, that has been my experience in the workforce.
Some self-realization there.
Yes.
Yeah.
And so I realized, how did I get here? Wasn't by myself. I had support from other women, other people along the way and people who not necessarily in power over you or anything like that, but people who had your best interests at heart and would push me and would guide me. My mom
Very
used to,
necessary.
yes, very necessary. Women, we are people who need each other, we depend on each other, but when you're moving from one position to another and situation, I find that support that you get, that is incredible. Because it's like sisterhood, or this, I don't know, this bond that as women we share, and we help each other, and it's like, okay, I can fly. I remember telling someone that all the time, that they're going through this difficult time, but you are going to get there. You can fly. And there's nothing more than having somebody really believing in you and telling you that you can reach the stars.
Wow. What are some barriers you believe prevent women from leading, or from even wanting to lead in healthcare?
Good question. I think one of them is fear. Fear and this defeatist, self-defeating attitude that we tend to, is like, I want to, but I don't think I can. I don't think I have the skills, or the time, or the opportunity. We make excuses. There are so many things, but I think, yes, there are external challenges as well. But I think for me, what I've seen is it's the worst times that if I don't achieve something is because of how I think about myself. In other words, if I feel like I'm just going to fail, why bother? Then I won't even try.
It's almost like manifesting it.
Yeah. You've already predicted that, right? It's like this self-fulfilling reality that you've created for yourself that doesn't exist, but in your mind. And you're telling yourself, I'm not going to do this. I can't do this. And there's no such thing, that we can't do. But fear tends to make us feel like, we don't have the abilities and we can't do this. As well, I find self-awareness. Self-aware, like everybody has flaws, everybody has weaknesses. And if we allow the negative things or things we don't like to hold us back, then definitely we're not going to achieve our goals, right? We have to learn to overcome them. And so those, I think, are probably the most important ones, is the ones that we inflict on ourselves.
So fear and self-awareness. How was your career in mental health, and how has it assisted in your leadership at the food bank?
Yes. That has been, I've worked in mental health for almost 10 years, various capacity, actually managing all the portfolios, from the hostel outreach, which is working with the homeless, the court diversion program, access program at CAMH, various different programs. But I think what I learned from them was, one, not to give up. And I say that because of the clients that we served during those times. I find that when you're going through a really, really difficult time, there are times when we had clients who were going through, severe schizophrenia or bipolar or whatever. But one thing I admired was their tenacity and their strength, that for those the fact that they would even seek help
Mm-hmm.
was amazing. And to hear some of their stories and what they were going through, it was, you just basically, even though you're not supposed to get close to the clients, too close to them, but you couldn't help feeling like, oh my goodness, you felt sorry for the situation. But at the same time, I admired their strength of what they were going through. Issues with medication, the medications were not foolproof. They have lots of side effects.
Yeah.
But these people were reaching out, and they would reach out. That took courage.
Yeah.
And I thought, what would I take away from them, from their experience, would be the strength and the courage and the endurance that that they had in the worst times in their lives. If they could go through that, I can overcome it, whatever.
So when you began your career in health, did you imagine you would have a leadership role in the future? Well, by what you're saying, it would have been many. So did you imagine that you'd attain all of these roles? Leadership?
I did not start out thinking that. No. My mom used to sort of steer us into that direction. When we were in high school, my middle sister and we worked with ComCare.
Yeah.
And so that's where we started off in the healthcare field. And we worked, and they trained us to be private duty nurse. And we worked in all the hospitals and nursing homes, long-term care facilities in the city. And we were like a tag team. We both wanted to be nurses. My sister, she went on to be a registered nurse.
Yeah.
And I decided, after a while, I didn't want to be a nurse. I went into the medical lab field. I became a certified lab technician, and I enjoyed that.
Yeah.
I was really good at it, and I, to me, that's what was important to me. Being, mastering my skill, being good at it, so I can serve people and help them. I wasn't thinking of being the leader in any way.
Yeah.
And I found people started recognizing my abilities and would recommend me for things, and I was like, what? And I quickly moved into the office and came off the front line and started managing the clinicians from inside. And one thing led to the other, and then I left the lab and end up at doing therapeutic care in another company. And it's just been incredible. Wherever I work, I end up becoming the leader for my division. But it was certainly nothing I planned or expected.
What drove you to your career in mental health? Like, at what point did you realize that you wanted to venture?
Well, while I was doing, I had a very, it wasn't straightforward. I didn't just start off deciding I wanted to go into mental health or psychology. I went to school, went to York, and I was doing, I tried to do business ad, and I thought, oh no, that's not for me. I tried different things, and it was not for me until I started taking psych courses. I started doing, and it's funny, as I realized, oh, I enjoyed this, learning about people and how your mind works and all this. And so I switched my major to psychology, and I really found that I like this. I enjoy doing this.
Yeah.
And eventually, I got my degree in that.
Yeah.
But it didn't start off that way originally. So it was like I fell into mental health. It just fell in my lap in a sense. I didn't go looking to take on that role.
It
But
found you
after,
instead.
yes, exactly. But I enjoyed it at the time.
Okay. All right. So, from your experience, then, why is food insecurity a problem in Toronto? And how has this inspired you to be a leader at the food bank?
Well, food insecurity at any point could affect just about all of us.
Yeah.
And especially during this past couple of years, 2 or 3
Right,
years
with
with
the
the pandemic, it
Mhm.
has increased tremendously. So, there's a very fine line between people who are working and people who aren't, in
Yeah.
terms of what can happen and how easy and how quickly they could fall into food insecurity. And so you have people in a situation where they have to choose between, do I pay my rent or do I feed my kids? What do I do? So
So they have to prioritize.
exactly.
Yeah.
It is an
Yeah.
epidemic.
That's tough.
It
Yeah.
is, because there's so many people are working and still can't afford to buy food and pay their rent or their bills.
Both,
And forget
right.
about putting your kids into any kind of extracurricular activity, because you can't afford, you're just trying to keep a roof over their heads. So there are
Right.
many factors that affect us. And
Mhm.
working at the food bank has really been an experience for me, because I see firsthand what's happening to people. I get to hear their stories when they come and you sit and you talk to them. How was your day? What's happening? You find out that there's so much that they're going through, that when they come, I try to make sure that we provide a positive experience for them when they come to the food bank. It's not easy. And
I can
knowing
imagine.
that you're trying so hard to take care of your kids, to even to find breakfasts, to send them to school, it's really hard. And I remember a case, and I remember this particular case where a client came in. She came in with her daughter, and apparently she had, I think she was going through a divorce, but she had no food at home. And so she couldn't send her daughter to school because she was afraid that the school, the teachers and authorities would find out that she was not eating. She didn't have breakfast to give her child to go to school. And I could see when she came in, she just broke down in front of me. And
Devastating.
she was crying. And when I think about the stress, her stress level at that time, what she was going through, when she came, she started to explain some of her situation, and I told her it was okay. No problem. Don't worry about it. You're going to be fine. And we gave her enough food for the week, and more. Her daughter, what made me realize how bad it was when her daughter said, "Oh, Mom," she was so happy that she had gotten so much food. She says, "Oh, I can go to school now." And that just touched my heart. It made me realize what was going on. And, it's very hard. Food insecurity is something that I think the government should put as priority.
Yeah.
Because to know that I think a lot of the mental health that parents or people are going through right now would probably be less if we had that, if they saw food security as a right, rather than whether you can afford to do this for yourself.
Definitely.
You know what I mean? It's a shame, honestly.
Yeah.
And
Yeah.
during the pandemic, with people not working and the isolation and
Yeah.
everything, it's just all triggers for people's, you know, deterioration of their mental health.
Can you comment on how food insecurity can affect mental health, and if there are certain groups that are more affected?
I think just the idea of not having enough or not having to be able to take care of your family's health is probably one of the most devastating triggers for mental health. Because a lot of our clients, we have at least, I would say 40% of our clients are children. So when you have a family that has at least two children, so a family of 4 or 5, and you have all these mouths to feed and you don't have anything, you have nowhere else to turn because you're not working, or even if you get help from the government, it's not that much. It basically just pays your rent. You're at a loss as to what do I do?
Yeah.
And so it's hard. It's hard dealing with that type of stress. And on top of that, the stigma that goes along with going to a food bank. I'm not sure if you're aware, but a lot of people, I know people who want to come to the food bank, but
They fear.
They fear people knowing that they're coming to a food bank, or if sometimes I know people who other people will tell them, oh, don't go, why are you going to it's a food bank? Like they add this extra pressure on the person by making it seem as if it's very demeaning and you know, that's hard.
And then there's social comparison.
Exactly.
Yeah.
And you already have all these social issues that you got to navigate. You have to find, you know, you have to try to get help with what do you call it? Not just with food security, but you also have to navigate services to help your family. And sometimes going to the system, it's hard, because imagine you go to one of the community centers or community services to get help. You can't pay your hydro, you can't pay your gas, you can't pay this, but you have to have proof of this and proof of that and all these things. You're looking at people who are marginalized, at risk, have all kinds of issues going on. Some of them navigating barriers of language, access to services, so many things. All these are triggers that affect people's mental health. And it's not easy for them if they're not aware of where do I turn for help. And also you're looking at cultural barriers as well. Issues where there are people who know they need help, but because in their culture it's looked down upon for you to go outside and get help, they don't seek it. And so you're adding to the pressures and creating more isolation for that person. There are so many factors that you can go on and on that affects mental health. And especially in this environment that we live in, it doesn't seem like we're going to go backward. You know what I mean? People keep saying, when are we going to go back to the norm, I think we're living in a world where it's a new norm now, where we're not going to go back to 100% what it used to be before. So it's like, okay, well, how are you going to navigate the future? What is there a future? You know what I mean? So it's very difficult. It's very difficult.
Do you primarily serve the GTA?
Yes, primarily the GTA, because each area, when it comes to the food banks, have a certain boundaries.
Yeah.
Now we don't. We started to operate, like for example, in Etobicoke North, you have several food banks. They're not all part of the Daily Bread system. I think there were 3 in the area. So what happens is the clients, we would inform them of the situation where, okay, where you could go, when you could go to like a daily bread food bank and non-daily bread food bank. But for the most part, we tried not to have boundaries. So if somebody could get to the food bank and it would, you know, they were okay getting there, not a problem. We would serve them. I don't turn away people. I think
anyone.
Exactly.
Do you believe more women leaders are needed in combating food insecurity and mental health, and why?
Well, I could tell you why right off the bat. 50 to 60% of our clients are women. You see more women coming out. They're the caregivers. They're the ones, and those, to be honest, a lot of people who are coming to the food bank, it's the wives that are, or mothers or whoever that are even working, trying to work, but they have sick ones at home.
To feed their household.
Have to feed their household. They have to take care of them. They have to put their kids through school. They're doing, so there's a lot of pressure on the women. And they're the ones out there that's trying to make sure that they survive. You know, some of our clients who are here for newcomers to the country, what I find is healthcare seems to be a major issue for them. And I say that in the sense, some of them, they might have issues with diabetes or cancer or heart issues, other ailments. And what we've done in the past is, because of our partnership with other organizations, we've been able to, you know, offer assistance, like get them help to help them deal with some of the issues, the health issues that they have to deal with at home. But it's really hard for women on a whole, I would say, being a caregiver and working, trying to make ends meet. And at the same time, if you're in a leadership role and you have all these things tugging at you that you have to take care of, not just at work, but at home, you can see how it's easy for your mental health to be affected. You know, too many responsibilities with not enough support can definitely, you know, be a recipe for that. But we do need, I think, being women in power, it's a very, very positive thing for our future. Because we as women are the mothers who are going to keep our, what should I say, our generations and our communities going, and be the strength for society, because it's women who often push through. They find something's not right, something needs to change, we don't like this. That's true. You know, they complain a lot, so
we're advocates for change.
Exactly. So sometimes it's a good thing. So definitely, I think to have women in leadership is a really good, it's a good opportunity for the community, for people at large. And I would love to see more women in leadership in running the country. Women who care and remembered where they came from and how they got where they got.
On that note, well, I'd just like to brief our viewers that I've actually worked with Cossetta previously as leader of the Mount Olive Food Bank. And I'd just like to thank you for your services, both with the food bank as well as mental health, just in general, your good deeds. they don't go unnoticed, and I hope they won't, in future. And thank you for coming on and sharing your voice with us.
Oh, you're welcome. Thank you for inviting me.